the role of a primary care doctor
Yep.
has evolved a lot and changed a lot in the
Sure.
last generation.
Yeah.
What are your, how do you think that is? How do you think what do you think the changes are?
I mean, I think the changes have been negative for the most part.
Okay.
And I hate to say that about a field I'm so passionate about, especially when I'm trying to sell it to med students. I think it needs a lot of help. Things that have changed, reimbursement rates have fallen, meaning that you're not getting reimbursed properly for the time that you spend with your patients. For example, if I see an individual for 15 minutes, I get reimbursed for that visit, but then I could spend an hour on administrative tasks, making sure that their note is completed, their medication is covered, their imaging is approved. I'm calling them, talking to their family members. And the reality is there's no industry where you would spend an hour's time of work not being compensated. But in primary care, that happens all the time. In fact, there's been studies that show for every hour that you do with patient care, there's probably 2+ hours that you're spending on administrative tasks, and you're not compensated for that, nor is that a rewarding aspect of your job. Most of us that go into primary care want to be with patients. We don't want to be sitting with charts or computers or arguing with insurance companies.
Right.
So I think that has changed. The implementation of electronic health records has been bittersweet.
Okay.
There's been some good parts to it. Obviously, it's a lot easier to search a chart than it is to look through terrible handwriting of 10 doctors.
Good luck.
But it still was problematic because it would add time to, again, that administrative burden where I'm seeing, let's say, a newborn for a visit, and I'm trying to sign the chart and be very efficient. And the thing is telling me you can't move forward to the next section because you got to go back because you didn't enter the smoking status of the infant.
Right.
Infants don't smoke, so we don't need to do that. Let's move on, electronic health record. But that adds, 10 other clicks. And when you're doing that, I think you're extrapolating that to, 30 patients that you might see in a day. That's a lot of extra time that you're just clicking around for nonsense.
Yeah. It's interesting because I definitely hear that on my side dealing with, a lot of Medicare programs and Medicare reimbursement stuff. There's you said it's bittersweet. There's obviously the advantages of it.
Sure.
But I think that it's kind of like a layer deeper where it's as the government pays for more and more and more programs, and Medicare Advantage now taking over and these various ACO programs that they kind of are dictating how you do medicine.
Sure.
So on the one hand, it's like we want the government to pay for it. So, but then they're like, okay, well if we're going to pay for it, we're going to make rules and we need to know what's going on. And so it is kind of
it's messy because what happens in government, and my biggest critique of it, is there's very little collaboration between lawmakers and actual frontline clinicians. So there's people who are in the administrative C-suites that maybe meet with the insurers or the politicians to tell them what's going on. But very few of us who are actually seeing the patient, seeing what the communication breakdowns are, what the struggles are. And that was my hope would be by launching a YouTube channel, we could highlight those voices, we can highlight those problems and bring them to the forefront where the everyday person can go into a visit with their doctor and realize their doctor's staring at the computer, not because they're rude, but because if they don't, there's no way they can see the patients for the rest of the day.
Yeah. Government is, I can say a lot on it. It is definitely bittersweet. One of my favorite people, Dr. John White, we talked about him earlier. He in his career, he jumped back and forth between private sector and government. He was at the FDA, he was at Discovery Channel and CMS, and he was a little all over the place. And I think the lifers in government are a real problem. Like the people that their entire career A to Z is in government. Because when you take someone like him, they have that perspective of both sides of the coin. And he knows how ridiculous it is. He was laughing to me how they were once at a meeting, and he said this was a regular occurrence where they'd be at a meeting and they would talk about some new initiative or program that they wanted to roll out. And they would say, let's say it was January, and they would say, all right, we're going to start this in June. And somebody would raise their hand and say, all right, what year? Everything is so incredibly prolonged and just a lot of red tape. So
we could probably have a 5-hour conversation on that one issue alone, let alone all the healthcare hurdles.